Go for it, your question.
I'm Jan and I work in the community, and my question is about equal pay for equal work. Are you aware that community health nurses, such as those working in generalist and mental health community teams, receive significantly less pay than allied health practitioners performing exactly the same roles? If you are elected to government, will you guarantee that all community health nurses will receive the same rates of pay as their allied health colleagues who are performing the same roles? And to give some context to this, I'm not talking about a few $100s, I'm talking about in the region of $15,000 a year. And I'm talking also about management and clinical areas.
Thanks, Jan. Adam, it's your right to reply first.
Yes, I mean, absolutely. I think there does need to be equal pay for equal work, regardless of what setting you're operating in, and we would be happy to make that commitment. And the problem's also particularly bad in aged care, but I recognise that there's little that the state can do about that, and our federal counterparts have been working away at that and will continue to do so.
Thank you.
Community health services will become a more critical component as time goes by, as we move down what I keep saying is the ageing and chronic disease issues we're going to be facing, and how they interlink with Queensland Health and also the Medicare locals is a question in my mind. Can I say this, Jen? I can't give you a statement today, but can I say this to you? I will give you a commitment that I will work with you and your fellow officers to achieve a parity, but I can't say that I can give the commitment right this second in time.
Thank you. While you had the floor, do you want to make your comment now?
Yeah, can I make a comment just about the issue of criteria-led discharge that was raised in the paper, and I think Beth or someone else made a comment today about that. I am very attracted to that. I am very attracted to that as a principle. What I would say, however, is there are a couple of questions that I have to get straight in my mind, and they are, who sets the criteria? Are we talking about the physicians, or are we talking about some other criteria being set up? I want to understand more about that. I want to understand too, what type of patient are we talking about? I mean, I'm assuming you're not referring to ICU when you make those sort of comments. I don't know at this point in time. But are there types of patients you would like to consider and types of patients you would not consider for very obvious reasons? What are the qualifications of the RNs? Are we talking about them being skilled up yet again? Is that required, or are we looking at not of the head there, so shake of the head, my apologies. So all I'm simply, these are the questions I need to look at before I come to a conclusion about that. I think the other issues that I want to look at are there any issues of liability that have to be addressed to protect the nurse, first of all, and other people involved? And the second thing, or the last thing is this, in my opinion, this must be considered as one tool in freeing up beds within the hospital system. But I think my first couple of points are, who sets the criteria, what type of patients are we talking about in relation there to? That wasn't covered in the article that appeared in the Courier Mail, and I think it's just important that I understand where we're headed to with that down the track.
Thank you.
But I'm very attracted to the idea. I won't talk about physiotherapists or other people as well, which are referred to in the article as well, but I want to understand those questions before I can take it back up again.
Thanks, Mark.
And
Minister.
I think Daniel was dying to make a comment, but I won't. And I might talk to you
We'll
after
have to talk to
the
him
meeting.
later.
After the meeting.
We'd all be very happy to teach you about criteria-led discharge.
Yeah.
Dan, I'll move on.
I know what criteria, what it means.
Yeah. Happy to teach you how it works, or not work. Minister, on the real question, Jan's question, and of course criteria-led discharge, if you'd like to make a comment.
Firstly, can I just ask for a little clarification in relation, excuse me, in relation to your question? Community health, you're talking about community health nurses and allied health professionals employed by Queensland Health?
That's correct.
Right, okay. Then my answer to you would be yes, in principle I do, and that it would be through the process of a work value within the industrial relations, the conventional industrial relations process. I'm not familiar enough with the detail of the disparity that you identify to comment much beyond that. But there is, as no doubt you are aware, there's a work value process that can be undertaken by the parties, Queensland Health and QNU, through the auspices of the Industrial Relations Commission, to identify the extent of disparities between equal work done by different professionals, and then to look at how the remuneration is appropriately adjusted to reflect the equality or whatever the outcome is that the Commission arrives at. So I'm very familiar with the work value process from my industrial background, but I just don't know I don't know enough about the detail of the different classifications you're talking about. I would support very much that they go through that work value process. On criteria-led discharge, I commend the Queensland Nurses Union for the strength of its advocacy to broaden and deepen the skills of its membership and the nursing profession, and that includes their capacity to use a criteria-led discharge to assist in patient flow and access from and movement from the hospital, from one ward to another, but eventually, obviously, to home. Bearing in mind the indulgence that the Chair provided to my colleague, I might take a little bit of licence, if I might, Sally. But seriously, I think that what the QNU's been doing around criteria-led discharge is excellent work, and I think we need to work a lot harder in that area to convince complementary professionals working with the nursing staff that this is a way forward to improve accessibility of the public to medical and health care in our hospital system, and also to free people up to be moved out of hospital to subacute care and then eventually to home. It's all about patient flow and making sure that nurses are appropriately qualified but to exercise clinical judgment that is well within their capacity to exercise. And I support that 100%.
Thank you, Minister.
Good. Thank you for your indulgence.
That's all right, you did very well.
Thanks, Jan, for your question. I think, regardless, I think it's quite obvious that there should be a level playing field in the terms of remuneration when it comes to community health services or allied health nurses. I think the reality is, though, and we can all stand and say, yes, we're going to support it or we're not. Of course, the Australian Party would support that, but I think the more important question would be then how would you support it, because given the hundreds of millions of dollars, I think that's where the answer needs to lie, because as politicians we can all say yes and no, so I'll concentrate on where we will get that money from, and I think this is symptomatic of a very common theme right across the board. We've seen it in the police service, the teachers, every union's lobbying for money, and these people are getting wage rises less than CPI. And once you look at the bigger picture, which is where the Australian Party comes into play, we're not producing nation anymore. You've only got to look at things that are closing down. We have a mindset of government, and we have for the last 20 or 30 years, of selling and spending. So they sell our assets and they spend, whether it's fairy floss on your roof, whatever it is to get your votes back. That's what they'll do. They spend billions and billions going out. As a result, we have an increasing public sector. We're not producing any revenue for the country, so of course we can't. The cost of living goes up as a result, but we can't increase those wages. So when you deregulate the milk industry, the sugar industry, we see the manufacturing industry collapsing. We've seen WOW go down the gurgler. We saw the tomato industry produces 30% of the tomatoes. We see Coles and Woolies duopoly, which reflects the Coles and Woolies duopoly of politics. That's all it is. It's a reflection of the political system. Our economic system is a reflection of the political system. So we see our country as a nation, we're not producing, we're collapsing. So until we get in a mindset of generating wealth and producing, then there's no way that any government could promise to increase those wages. So, and that's the philosophy and mindset that we need to snap out of the 2-year political cycles, and let's look at a 20 and 50-year vision and empower the public sector.